In the past, we need a catheterization to be sure that the patient has a heart defect. But nowadays, because of the advance in the imaging systems, especially the echocardiogram and the cardiac MRI, it makes the diagnosis much simpler and much faster. So we can come up with a diagnosis, a working diagnosis, just within an hour or two, right after birth. And also these advanced technologies in the surgical area, we know how to protect the heart, we know how to repair. So it makes the surgical outcome far safer than before. And also we can use a catheters to treat certain type of defect without surgery. We call catheter interventions. Now the cardiac catheterization is we are using a small plastic tube and insert it to the blood vessel in the leg or in the neck and snake it to the heart. And when it gets to the heart, we can measure the pressure inside the heart, we can measure the oxygen content in the heart chambers, and we can determine what is really wrong inside the heart. But right now we don't really use that because we have an echocardiogram that can demonstrate really nicely the structural heart defect. And we can also study the function from the echocardiogram. Nowadays, the catheterization we use for the treatment most of the time. Now the treatment is we have used a specialized catheters which it can equip with a balloon at the tip. And when we get into the heart, we can use that balloon to widen a narrow vessel. Let's say narrow arteries or narrow veins. And we can also use the balloon to narrow a very stiff valve. And also we can use a catheter to deliver a special design device to close the hole inside the heart wall. And we can also use that to block up the abnormal artery that we don't need. Okay. It can be done, but not every patient can be done. It has to be carefully selected. Only a suitable patient that we can do that. And nowadays, for an older or a young adult, we can even use a catheter to repress a defective valve. So this type of technology is help a lot, improving the outcome and also decreasing the morbidities. It is a minimal invasive, and so the recovery time is very short, just a day or two, without cutting up your chest.